The Fitch-Rona EMS Commission meeting is called to order. We'll do a roll call.
Sure, Michelle isn't able to join us tonight, so I'll be doing double duty with kind of giving you my stuff as well as doing some of the roll call stuff. So we'll start with Shannon Strassman
Here.
and Connie Hilla and James Roberts,
Here.
Kate Cronin,
Present.
is over there, Greg Miller,
Here.
Derek Johnson,
Here.
and David Lonsdorf. Here. Sue Lugenbuell, they did tell me she was not going to be able to make it, and I got Greg Miller down here twice. It'd be Terry Schnapp.
I don't know.
I got him.
Yeah,
Terry's here.
Oh.
Gotcha.
Here.
So we do have a quorum, and we can hold a meeting.
Okay, thank you. Do we have any public comment?
I have nothing that was sent to me. There's nobody present.
Okay, we'll move on to review and approval of the minutes from June 17th. Is there a motion to approve?
I'll move approval.
A second?
Second.
All in favor?
Aye.
Aye.
Any opposed? The minutes from June 17th are approved. And move into the chief's report.
Let me pull it up and move some screen stuff around here. I only have one screen tonight, so. That's what I want. There we go. So you should have had this in front of you in your packet. So last month was another busy month. You see, we've been topping 300 calls since February. So we're back to where we were. Only 6 of those 6 that you see at the end there were the Alliant Energy Center calls. So those are taken out of that number there. So that truly is 320 calls for service for the month. So yeah, we're at almost 10% or 9.1% for the year. So it continues to go up. We're expected 4,700 for the year, and we will most likely hit it. Everything else, Fitchburg has been a little bit busier than we have seen in the past. It's up a couple of percent. You'll see our CAR 15 responses in Narcan. Our overdoses have been a little bit up. That's been the trend countywide. As far as our fractal times, we're right where we want to be, so we're up to about those 10.5 calls per day that we've seen rising there in the past. As far as our training this month, we just completed our second session yesterday with our UW group, and it's been on neurological emergencies, a lot of seizure stuff. And then Christy, who does our internal training, has put together a burn care. So estimating appropriate burn care and some practical exercises with that. Other thing we have going on is through our consortium, we actually have some, I'll call it diversity training. So there's actually 4 different online modules that our staff have been taking on harassment, inclusivity, and diversity that we've been working on as well. As far as community events, one more week out at the Alliant Energy Center. The 26th is when they close down, so that'll be our last week out there. We went out to the high school and supported that for their second round of students here about 2 weeks ago. So that's really what we've been helping out with. And then just confirmed yesterday as we've set up with supporting some of the events out at the Expo Center and the Alliant Energy Center. So next month we'll actually have coming up 4 days out at the county fair, which is going on, as well as the CrossFit Games at the end of the month. So just got those dates, and we'll be sending our bike medics out there as long as with an ambulance as well towards the end of July. There's our other numbers for you, the calls by day a week, hour of the day, calls by municipality. As usual, our calls for service, it's that sick person in Falls that continues to just flip-flop back and forth. One of our as we're settling back in and the world is opening back up and kind of looking at where we want to go for this year and next year, and that's to get back in with Dane County and try to do some of this fall prevention stuff. We see that is the number 1 or number 2 calls for service forever. So anything we can do to get back out there in the community and try to get some fall prevention stuff done will be a priority for next year as well. And I believe I've brought up our Leave a Dose program That's part of, we actually just got that approval on Tuesday through the Department of Health and Human Services through the state. Did I share that? I can't remember if I shared that with you, but we got approval to do it. It's actually working with Safer Communities of Dane County and Madison and Dane County Madison Public Health. And what that is when we go out to patients who are suspected narcotic overdose or a known narcotic overdose, we will actually leave a dose of Narcan with them. With that will be a pocket mask as well as a resource guide to recovery. And that is actually sponsored through the state, so we're not paying for any of that. It would cost us to print the resource guides, but beyond that, the Narcan is provided by the state, then is provided through the county who gives us that. So we just got our approval for the implementation. We have to train our crews on kind of the guidelines for doing that, but essentially is going to be no cost to us. Part of the kind of the curve to that, or expecting that resistance of are you just enabling a problem? What we work with that Safer Communities, who truly takes that approach of maybe this is the one where somebody's going to seek help. Meanwhile, it has saved a life. If we don't leave it with patients, we can actually leave it with family members as well. So it's part of getting that Narcan out into the community and trying to give roads to recovery to people. So that's something that we're going to spool up here next month. Those things are already on our trucks. It's just training our staff. As far as our calls by station, right, that middle station remains the busiest as usual. As far as our receivables, they're right where they should be. As you can see from our cash on hand there, a little lower from last year. We're going to talk about that when we talk about our budget, but otherwise we've got enough to where we're going to be fine for at least this first half here, and then the invoices for the second half of our municipal money will go out here in the next week or so. As you see, our retirement funds made a whole $5.58. We talk about that. That's gone down quite a bit since when we first established that account a few years ago. Haven't touched any of our assigned balances. So we'll see that $30,000 for the anti-idle system. We'll see that go away next month when we should be taking delivery of our new ambulance on Friday, June 25th. I sent that email out. It's going to the Wisconsin Fire Chiefs Conference in Green Bay the last week of June, next week, 2 weeks already. So that they can kind of show off that hybrid system that we have put on there. We'll be the first one in the state with this hybrid system. And the goal is to kind of, if it works for us, to show that off and get more people on board so we can get kind of better support up here in the Midwest. So then we'll take delivery of that ambulance there. It's been trying to play a pretty good shuffle game with and getting that converted over, still supporting the events that we need to support, and then doing some maintenance issues as well. So we'll probably have that in service probably the first week of August. Once it comes to us, it still needs some radios put into it, and then just the switching over of that truck. No donations for the month. June was a big hiring month for us, so Molly Jesberger, she's one of our full-timers, but started here as an LT. It'll be 19 years for her this month. Tom Bates is still, for those people who've been around, he's been a volunteer here for 31 years. He is the volunteer that we have. He's just about every Sunday for 6 hours from about 11 to 5-ish, I guess. He comes and rides with the crew every Sunday as a third, strictly as a volunteer. So and has been here for 31 years. He keeps saying he's going to hang it up, but then he renews his license and kind of comes and runs some calls. And then Ryan Robertson, he started here as an LTE, but then he's our last full-time hire. This will be 1 year for him in June. And then Jamie Ennis and Camden are 1 year as well. So they're two of our LTEs. And then there's just the calls for service that we've seen last month. That's what I have for my chief's report, just that quick in-house operating budget. You'll see, as we've mentioned before, our run income is down a little bit. Again, we're going to explain to kind of where that came from, but 38% of our expected income at 41% of the year. Our income from the municipalities, that's our first half, so that's at 50%. That'll jump up to that 100% here next month when we get our municipal money. Everything else in this report is actually pretty where it should be. Some of the big numbers that jump out. is personnel recruitment. You'll see that is 101.5%. Part of that reason that is over, and it's not a huge line item anyways, but when we hired the EMTs to help us out with the Alliant Energy Center, we do drug screenings and physicals on all of our employees. So that was why that line item went up of hiring those people. That was kind of an unanticipated adventure. Subscription and dues, that one went over as well. So we subscribed to the NeoGov system when we did the hiring process here about 3 years ago. The amount that they were charging us, we kept it because anticipated hiring in about 2 years from now. When they shut that system off, they completely wipe your database. And to bring it back online again, you have to pay that reset up fee. So we did a little bit of the math and said, it was actually to keep it for a couple of years was more beneficial in the long run. It wasn't going to cost us as much as if we had to restart the entire thing. They raised the price, changing that the other direction so that it would actually cost us more to keep it than it would for us to wipe it out and rebuild it if we wanted to again in 3 years. However, a little bit of back and forth, and I'm still kind of working with them. They shut off part of it. They didn't shut off the other part of it and continued to bill us for it. So right now we're over. I'm hoping that'll come back down as kind of I negotiate with them as some kind of frustrations with that process. Other line items you see up there, we talked about, I've shared with you the radio equipment on there. That was when we upgraded our cradle points to the new system when we switched over to FirstNet. So we see that the increased cost in the radio equipment because we had to buy the new cradle points. However, what we get in a rebate from the phones that we switched over to FirstNet will actually offset what we ended up paying for the cradle points. So you're going to see one be higher, the other one's going to come lower to offset that. But those credits don't post for about 2 months. Safety equipment, I've mentioned that in the past. That is the PAPR hoods that we had to buy in the beginning of the year for the ventilators. And then computer support, the reason it's up to 88.5% this far into the year, every year we replace 3 workstations at each one of the stations, and then that moves between each one of the 3 stations, then myself, Jeff, and Michelle's computers, and then the ambulance computers. So we have it set up for every 5 years. We replace workstations, so that's why it's at 88% already, because that money was spent to replace those workstations. That's not an ongoing cost. So we should be good through the end of the year. Any other questions? Overall, you can see we're at 40% of our expenses and we're at 41% through the year. So our expenditures are right where they should be. That's what I have for a chief's report.
Okay, thank you, Chief. Chair's reports, I don't believe personnel or finance met, so we'll move on. Everybody get a chance to look at the accounts payable. Are there any questions? Yeah, maybe we need to.
They did get emailed out if you had a chance to look at them. Otherwise, there's the paper copy if you want to wait till later and people have a
Yeah,
chance to
we'll
look at them.
give everybody a chance to look at it. We'll move on. Let's review and possible action on the GASB 54 revisions. Any discussion or questions?
So if you remember what that is, it's just those items that are assigned to things.
It is pretty similar every month, I guess.
It's the same the only thing that so far changes every month is that retirement fund. So when that retirement fund changes, which is every month because we get $5 in interest on it, that will change again. Next month you'll see the anti-idle fall off there. The CD for the ambulance purchase down there, the timing on that is actually off. It's set because we get a better interest rate if such a thing exists these days. The interest rate on that, we had it set out for a 2-year CD because then it actually earns a much higher percentage rate. Unfortunately, that doesn't mature then until February of next year. So the ambulance purchase CD matures on off ambulance purchase years. So that 9,000 is going to sit there. There's a penalty for drawing it out early. When we get our new ambulance, everything gets converted over in August and we go to sell the old ambulance. We'll identify what that fund is we'll take that $9,097 and put it in towards that. And then when this CD matures in February of next year, we'll make up the difference from what we actually sold the ambulance for, set it for 1 year. So then that we're actually good on timing then for that true ambulance, that dollar.
Any questions? If not, motion to approve,
I'll make a motion to approve.
a second? All in favor, signify by saying aye.
Aye.
Opposed? Hearing none, the GASB 54 report as submitted is approved. Discussion, possible action on the EMS Commission Chair appointment. I've been chair for a couple of years and we'll be ready to pass the baton if somebody's interested. Just a little reminder, the last two chairs became mayors, so if anybody, no? Okay, I will continue. Just thought I would give anybody the chance.
We call you Mr. Mayor?
Yeah, not yet. I'm not interested in being a mayor, but, okay, let's move on. Chief, I guess presentation and possible action on the 2022 operating budget and discussion about some of the issues, I guess, that we had.
Sure. So I put together just a little bit of a presentation for you that's going to guide you through the sheet that you have in front of you, that Excel spreadsheet. Except I hid most of the slides, I thought, or not. I may have grabbed the wrong presentation. Nope, we're good. I just didn't hide the right slides. So I'm going to start here. This is actually where you'll see what comes from the annual report. So looking at 2022, anticipating about 3,700 calls. We'll actually, we're on par for actually potentially hitting that this year. But looking for next year, those are our current fee schedules, 1,100 for a resident and 1,200 for a non-resident. We revisit them every 2 years. This fall, or for projecting for 2022, we'll be revisiting that. So I will probably be bringing that up in about August, September timeframe for probably the finance committee to look at and to bring to this group as a whole. I will send out the cost compares to what our neighbors are. We're not the highest, we are not the lowest, but we will take a look at those. So there's the potential to raise that next year. Pending what this commission decides to do. One thing to kind of look at, and you'll see here, though our run income continues to go up, that collected, that 47% continues to go down. And there's most likely a direct correlation to we can raise our fees all we want. Medicare and medical assistance, workers' comp claims, they still will only pay X amount of dollars. So really, we're just rolling that over to patients and commercial insurance. But we do see an increase. We just also see an increase in uncollected. Those items we're never going to collect. As far as our no transports, again, same thing. We charge $100, $150. It's $150 to $450. If it's truly just we go there, we assess, kind of we didn't do anything, and we move on. It's $150. We do have a treat on scene cost. That's that $450. Say somebody's having an asthma attack, and we do some pretty good interventions for them and leave. That cost is higher. 22 cents a mile, and then last year we raised our standby fee to $130 an hour. So that is our current fee schedule as far as collectibles. So here's where we're going to see kind of venturing down into what Brett from the audit showed you, and I'm going to explain to you how we got here. So our 2021 budget, it was $1.7 million as far as what we expected in run income. So you're going to see for 2022, I lowered that to 1.5. So the expected run income then went down about $218,000, which was about a 12% decrease. I'm going to show you how we got to where that number should have been to begin with. So as Brent explained to you, the expected run income for the last 2 years was below where we thought it would be. So I went back and traced. I'm like, how did we? What did I miss? So if you go back to 2015, there's the number of calls that projected run income, and then that reimbursement per call. So if you look at it, 2019 there, something happened, right? So this is where I went back and said, where did we start? What did I miss? Because in 2015, 2016, we were over by significant. 2017, we didn't collect as much. 2018, we were over. All of a sudden, we were $100,000 in 2019 under expected run income. We were under by $237 in 2020. One of the big keys in there is that 2019 was that year we added the third ambulance. And so that's kind of, as I traced it back, this was kind of my unknown. So went in and did the best prediction I could, like what was that third ambulance going to look like? And as you know, it started anywhere from January to June to August to September, and that date continued to change up until the day they started. Something changed in 2018 to the 2019 budget that all of a sudden my prediction of run income went really high. So what I did is said, right, 2018 was the year where this was last correct. The number to look at is right here. So this is, or I like to call it Lon's formula. This is Lon's phenomenal worksheet. Said if I just put in at the top of the page there, the number of calls that we anticipate, he had it broken down into, right, the number of no transports, the number of transports, and then how many residents, how many non-residents, right? You gotta love the accountant side of things, to figure it out at the end of the day what that run income was gonna be. So he had 30%, right, 29.8% of our calls being no transports. So here's what happened. In 2019, in an effort to figure out exactly what our no transports was gonna be, this would be me changing. Now, either this was me anticipating 20% or me keying something in wrong. I changed it to 20%, right? From what used to be 29%. 10% doesn't seem like a big number until all of a sudden it's 3,400 calls, and 10% is actually a lot of numbers. So what I did is from 10% of 10% of 3,400 calls, there's now roughly a few hundred calls there where I'm anticipating run income that we're not gonna get run income for. So what I actually did, right, so this is our actual run income was 1.4 million, to the difference of $182,000, as you saw before. If that would have stayed at 30%, our run income would have only actually been under about 7,000, not 182,000. The same thing happened in 2020, right? Left that number at 20%, which doesn't seem huge, except that's 20% of, or 10% of 3,600 calls. Actual run income was 1.5 million, to the difference of we underestimated $237,000. If I would have left that at 30%, we would have only been under by 51,000. Now 2020 was, something happened, if you remember, in 2020. It was kind of a COVID issue, right? So if I actually do go back and trace, our no transports did actually go up by almost 10% in 2020 as we tried to keep people out of hospitals. So that is a factor of why, had we even left it at 30%, we really would have been under by 51,000, because we really did no transport a significant number of people, but 51,000 is still a far cry from 237,000. 2021, as you can see where this is going, right, unfortunately this continued to perpetuate into the middle of what we're in right now. I left it at 21% because I did notice last year something, right, something here is amiss and not working. Our actual, so if we continue on to where we're at, right, our actual run income for this year is projected to be 1.6 million. So then if I take, that's taking real dollars in and projecting, if we continue on the trend we're at, we should be at 1.6 million, which means this year we're still going to have a run income shortfall of about 182,000. So this is where Brett had mentioned in the audit, we've been tapping into our reserves for the last 3 years to the tune of that under budgeted money. Any questions on any of that? So I'm going to kind of go through the rest of the lines about what the rest of the budget looks like, and then I'll share with you what that impact looks like to the municipalities. On the plus side, as you've seen, as far as our expenditures, we've been spot on. Every one of those years, we have not overspent our budget. We've actually been slightly under as far as expenditures. The problem is the anticipated run income. So we're not overspending, we're budget, we're underfunding what the municipal contribution should be.
Chief, I have a question. When you say we're tapping into our reserves, what reserves we have? Do we have a bank account, $400,000 in it or something?
Yes, sort of. So we actually, we have 3 accounts. We have a CD. We had a couple CDs. We moved those around because at the time, we're getting a better interest in the money market. So we have a money market and a checking account that are linked. We have $250,000 that always sits in our checking account based on insurance, like FDIC insurance, assurability. Oak Bank does that. It's a little more complicated than that. We did that a couple of years ago just to make sure that all of our funds were insured. Anything over that $250,000 sits in a money market, and Oak Bank transfers money back and forth to make sure that our bills get paid. We also have one other CD that's sitting out there, and that was in that chief's report. If you see in the tail end there on the backside, we have a CD that sits there for about $150,000 that sits, is renewed annually because it gets a little bit of a higher interest rate. So that is where that reserve sits. At the end of the year, when our auditors come, they look and put all those things together and say, this is what our excess is. And based on our intergovernmental agreement, we should have a reserve fund of somewhere between 15 and 25%. And that's what Brent was talking about last month, saying we're sitting right at 13%, just under where we are supposed to be, and we haven't got through 2021 yet. So we're going to tap into it a little bit more. I've looked at all this. We will be fine for 2021. But a conversation as we get to the end of here, we will be fine for 2021. But we're already below what our reserve should be, and we're going to need to tackle that in the near future. As far as operational expenses go, we kind of divide them into the 2 spots of wages and benefits. So this is, Michelle did a phenomenal job of helping me go through and putting in all of the wages. So this is the new wage scale for all of the new employees for 2021 based on their contract. Our workers, you'll see what went down. The workers' comp insurance, we did bring that down. That's based on a real number. It kind of, how all of this stuff even catches up is, though we look at it and I report it to you every month, it's really about that 6 months or at the end of the year when we finally see what the year, the year previous looked like, and we can correct those numbers. Workers' comp for 2021 was based on the 2020 numbers, which was based on our 2019 numbers, which was a best guess of hiring 7 new people. So we increased it by 1/3 in 2020 and projected that we don't get that rate until the middle of the year for the following year. So essentially we went 2 years with that estimating what 1/3 more people would look like. We were over. So we, by and large, have a fairly healthy group of people, although it is an aging workforce, but it's largely healthy. But that number now reflects what the real number, what we've paid for the last 2 years was, plus an additional, I think we went up about 3%, tracking back what it increases to. So we were able to bring that number down just a little bit. The other thing that's going to help with that planning in the future is, for whatever reason, our workers' comp renewed every year in April. So for the following year's invoice, or we got it in April. To project for next year, I actually wouldn't get that bill until April. So I didn't know what that number was until the next year. I was always essentially paying a year behind. We fixed that. So now we'll actually get that number in January, and we'll be able to predict what that number is going to be for the following year. But we were able to cut that down a little bit. So we brought that down 7%. The other one is that sick time over cap. If you remember, with our 2020, with the last collective bargaining agreement, and we had those 3 people who were already over their sick time cap that we owed them funds to bring them down to now what that cap is. 2020 and 2021 were bulk payments to those individuals. They're now paid out. So at the end of this year, they will be with everybody else on that sick time over cap. So we brought that number was actually able to come down. So now we will only ever be paying people who are over the 1,296 hours. We don't essentially owe anybody more than that. So that is why that number was able to come down as well. I did leave some funds in there, and I can get that number to you what it is. Get what that number is to you. Sick time over cap. is also something we'll have to start looking for in the future as we start looking for the post-retirement healthcare. I will have at least one person retiring next year, and kind of as I have shared, as I said, we have a healthy workforce, but an aging workforce. Within the next at least 5 to 10 years, we will see 50% of our staff truly retire, which is going to quickly tap into that $230,000 we have to pay for post-retirement healthcare. So we need to come up with a plan in the future to start putting funds back into that as those people start to retire. This is not going to be the budget year to do that. As I've kind of demonstrated, we're going to need some more municipal funds to make up that difference. So that number I took down, so there'll be some funds going in there, but not a lot. The other true couple bigger things in there, the fuel, oil, and lube, that is based on historical data, was dropped just that little bit. The repair and replacement parts, it went up. It's about $3,500. Again, that's based on historical use. It's just kind of everything everywhere. It costs more, supply chains everywhere. So this was based on what we did last year and what we're seeing, just the rising cost of getting anything fixed. We actually have an ambulance. Unfortunately got towed. It pains me to see our ambulances get towed because somebody always snaps a picture of it. We're actually sitting at Kaiser. It actually blew some fuel injectors last week, Tuesday. It's still sitting at Kaiser because they can't get fuel injectors. So they're calling around trying to find somebody that will sell them fuel injectors at a crazy cost. So that cost, we raised that cost as well. The other one is the medical supplies line item, which we have overspent the last 2 years to the tune of about 20%. So I truly did raise it to about 30%. That operating budget there, that $100,000 is what we spent last year in expenses. So, right, though we can get gloves now, crazy, the price didn't come back down, though that they're available. So there's a pretty significant cost in medical supplies, but that is truly what we have spent the last 2 years. Everything else has stayed the same, really truly in that effort to try to keep expenditures down. As I mentioned, we're actually, because we switched over to FirstNet, we're going to see a small reduction in our phone bill. We brought training equipment down. We don't have any big items to purchase for 2022. And then I took computer support down. As I mentioned, we plan replacing three workstations every year at each one of the stations and rotating that through. Trying to keep the cost of this down, that should actually be minus 4.2%. I figured we can skip next year. All 3 of our workstations, this year was the last year we had a Fitchburg Fire Station number 2 had Windows 7 computers on it still, which are not supported in security risks. So every computer we own now is a Windows 10 computer. So we should be able to skip a year of replacing workstations. Accounting fees we took up just a little bit. Next year is actually going to be the full audit year. If you remember, every year we either do a review, and then every 3 years we get a full audit. So the cost is going to go up a little bit next year because we went back 3 years to see what that cost was and raised estimating that's what it's going to cost for that full audit next year. Property insurance, that is one when we went actually looked, we hadn't raised our property insurance in the budget for the last 2 years. That was another thing that is now on a star on Michelle and I's list. We missed that. When we moved into that 3rd station, though we technically rent that station, the stuff that's in it, that's ours, we need to insure. So we've actually been under covering. We have had the coverage, we just haven't paid properly budgeted for that property insurance line. The billing service went down because they collect 3% of what they pay for us. So if we correct what we would be billing out, we will correct what we will owe them. So that is directly based off of what we anticipate getting. I did leave the paramedic internship program out again for a 2nd year. If you remember right, that's one we took out last year. We didn't have any participants. We do have some participants from students from Fitchburg Fire who are looking at going to paramedic school this year. I do have some funding, some of that funding we received from the state, that FAT funding. There's enough in there. It's not what it used to be when we helped pay for their paramedic program, but it's enough we can offer them something to help pay for that program. Linking that back to the wages, so as we look at here, overall, it's a 3.2% increase in our operating budget. And again, we've nailed the operating budget expenditures for the last lots of years. But it's a 3.2% increase overall in our operating budget. Again, most of that coming from wages and benefits. The other two big things coming from repairs of ambulances and medical supplies. If there's anywhere to cut anything, in the wages line item, as I mentioned to you, when we work with, we're going to be working with Madison College and trying to sponsor an intern for us from an underserved community. There is a line item for 6 months of a paid internship. It's an intern who would come in for 12 hours a week and ride with us, who's identified with between us and Madison College as a student of color. There is $6,000 in there for a wage for that student for 6 months. So looking if there's anywhere to truly cut things, that is about the only thing we have in there to cut. And I specifically left it out of the paramedic internship program to hopefully kind of keep that in there. In the big picture of $6,000, I don't know that it's going to make a huge difference. What does that mean to your municipalities? And again, I shared this with the finance director, so they are aware of this dollar. So for 2022, that number you see there in yellow, that's what's going to be asked from the municipalities. If you look down at the bottom there, it is an increase of about 18.5%. That brings us to where we should have been climbing over the last 2 years, that I under anticipated run income. What are your questions? At this point, it was I will fully own this. This was my mistake. It didn't get caught for 3 years now. That I had that formula wrong.
Will the municipalities be paying a higher cost to pay? Will that increase the reserve fund?
No.
So how do we deal with that?
So after talking with Misty and Brian and Sarah, my thought, and I believe they concurred, is to make up this difference in 2022. This is a large enough increase in mere operational side of things, right? I'm trying to show you the positive side of things is, right, we're nailing the operational budget. We're not overspending our budget. My mistake of underfunding it, that is a pretty significant increase in just 1 year to make up what we should have been doing. And then in 2023, we tackle how do we start funding the reserve.
Okay.
It wasn't a positive conversation. It was a conversation that, unfortunately, I hate to say it is what it is, but it kind of is what it is. It was my screw up. That should have been, the municipalities should have been paying more over the last 3 years than they were. But again, now because of that, we see this big increase.
So the increase actually brings them to closer to what they would have been paying the past couple of years if the formula was right.
That number is what this year's budget would have looked like anyways. Unfortunately, you're just doing it in 1 year versus what would have normally been 3. I mean, I guess the ask of you is, I kind of truly shared with you the really only places if you tell me to go back and cut more stuff out of there, I don't know where I'm going to be able to do it, short of $6,000 for an intern, which I think is probably a pretty good investment. And in the big picture of stuff, $6,000 divided 3 ways is not a huge, right? One municipality doesn't get that, you divide it 3 ways. There's not really anything else to take out of there.
Can we anticipate in 2023 the costs will go up again to start covering the reserve fund? Is that what you're saying?
Not by this. not by this, by any means, not by 18%.
Not that much, okay.
No, so whatever that operational cost is, historically, I think we've been about 3%. So I would anticipate it being about 3% plus whatever the plan is to increase that operational reserve. So whether that's to put $50,000 in there a year divided by whatever the equalized value is, that's the increase you're gonna see. It's not gonna be anywhere between, it's not gonna be even close to 138,000 per municipality.
So how much is the reserve short of the goal, so to speak?
Well, we were at 13% at the end of last year, so we will be probably about 8%. We will be 182,000 on 100, it's like 108,000, I think it was, whatever that number is again this year. So we'll probably be down into single digits.
So what's that in dollars roughly?
I don't know. I can try to figure it out based on what the rest of the year looks like and let you know. It's not gonna be zero. I won't have to go back to the municipalities
But
and ask for
Might be
funds.
something, I guess, just to let the municipalities know what we anticipate the increase be next couple of years, so for planning purposes.
Sure.
Yeah, that was the only reason
Okay.
I was asking.
Is there any other questions?
I noticed on our expenses, a lot of things were 0 to 2% increase, except for health and dental insurance is 12.2%. And I imagine, is that a typical difference? Health insurance goes up a lot more than everything else?
It does. We plan an 8% increase in health. We plan a 4% increase in dental. Just over the last 2 years, we've seen about a 5 to 6% increase in health. Last year, we actually saw about a 6% increase in dental. We also had one, Ryan Robertson, who had a baby year about a month ago, went from employee plus one to family. We also had another employee go to family as well. So it's not just the increase in cost, we actually had 2 people switch plans. But yes, health insurance kind of is always the big expenditure. Jeff and I do look at that at the kind of the end of the beginning of every year, and it always gets up because we are not part of the state plan. We broker our own, we work with our insurance company. It's Houseman Johnson is our broker. We still save by not using the state plan. Our plan still offers employee plus one, which very few plans offer these days. We have enough employees on employee plus one that if we were to switch to the state plan, which only offers single and family, all of those employees would have to switch over to family, and it would cost us more in the long run and higher premiums for all those employee plus ones versus paying a little bit higher insurance that we pay now, but offering that employee plus one. And we look at that every year, and we kind of try to adjust plans appropriately. We last changed it 2 years ago. But we still stayed with GHC. We just kind of, they bring you about 7 pages worth of shopping cart stuff and try to mix, changing some copays and prescriptions and deductibles and all of that kind of stuff to try to stay about the same.
This is something I've seen in every organization I've been on a board of or worked with, is that medical costs go up way out of proportion to every other cost. Even though inflation is only about 1 or 2% at the most, for some reason, medical costs go up 6 to 10%. And nobody seems to be able to do anything about it. Having worked in the medical business for 30 years, there's absolutely no reason why that should happen. It's not like, it's not that those are real costs that have to go up that much. They just know they can get it from people.
And that's why we struggle every year with when we raise ambulance fees. To me, all we're doing is contributing to that.
Right.
It is truly, you saw it's $1,100 to pick somebody up, to pick a resident up and put them in the ambulance and drive to the hospital and not touch them is a $1,200 base rate plus $22 a mile.
Yeah, I don't have a solution. I just think it should make everyone in the room mad.
So,
And if you have a chance to do anything about it, you should.
Universal health, maybe.
Yeah.
Any other questions or comments? Otherwise, I guess we,
there's one more. I got to throw my graphic of my monkey wrench up there. There's one more thing that's going to throw a monkey wrench into this. This one is not my fault. So the Department of Administration, the DOA, and Kate, probably, I don't know if you can share this as well. They overestimated the equalized value of Verona last year to the tune of about $100 million. Yeah, that's hence the monkey wrench. So though those numbers are up there, to correct that for 2022, that total percentage of evaluation of $3 billion of Verona, you need to take about 200 million off of that to correct for the mistake last year and correct it to what 22 should be. Again, that number was estimated, was shared with the municipalities. So Fitchburg's percent is actually more likely 20 to 21% increase. Verona's is actually more like about 15 to 16% increase because of that $200 million that's going to come off of the value of Verona for 1 year. And then things equalize itself. The town of Verona and their 5%, it'll go up a little bit, but it's a little bit. So I just thought I'd throw that monkey wrench in. These are still estimates. Fitchburg will be higher than that. Verona's will be lower than that. The town of Verona's will be higher than that as well, but it's not to the tune of more than about $1,000. So I guess what I'm looking for you is this in its form, unless you want me to go back and try to figure something out to make this any lower than I possibly can, which Michelle and I took this line by line and did the best we could to cut everything we possibly could, knowing that this occurred. What I'm looking for, I guess, here is a motion to either, it wouldn't be a motion, it would be tell me to take it back and fix it and present it to you next month, or a motion to submit this as you see it here to the municipalities. I guess knowing that equalized value, it'll get presented like this. Those equalized values we won't know until August or September.
Any more discussion? Otherwise, I am comfortable, I guess, moving it forward. Somebody want to make a motion to approve as the 2022 proposed, I guess not proposed, operating budget as submitted by Chief Anderson?
I'll make a motion.
I'll second.
Any discussion? If not, all in,
We're not approving the budget yet, we're just approving the
submission.
budget estimation or whatever.
Correct. So the budget process, and this is what we have fixed in the intergovernmental, not fixed in the intergovernmental agreement, but our budget is still subject to approval by each individual municipality, but I give them that.
Yeah.
Essentially, I say, I need a check for this, but it's a little easy, it's a little more complicated than that, because they get that spreadsheet that you have in front of you. But it still is encircled in big red circle, this is what I need from you. But you'll still see it at your town board with that number on it. And this is why I explain it to you, so that you can either explain it to them, or I get to come a couple more times in front of that hot seat and explain to them what I did.
Okay, any more discussion? If not, all in favor of Chief Anderson submitting the operating budget to the municipalities, signify by saying aye.
Aye.
Any opposed? Hearing none, the proposed 2022 operating budget for submission to the municipalities is approved. I guess that's how I say it.
Close enough.
Yeah, close enough. Any other business anybody wants to bring up? Oh, yeah,
Checks.
we gotta do the check register.
Was there questions on any of them?
We'll go back to the accounts payable checks. Were there any questions? If not, a motion to approve is submitted. Second,
Second.
all in favor, signify by saying aye.
Aye.
Opposed? Hearing none, the accounts payable checks as submitted by Chief Anderson are approved. And a motion to adjourn. Would, All in favor of adjourning, signify by saying aye.
Aye.
We are adjourned.